Cancer begins when cells grow out of control, but when it affects breast tissues, it becomes a deeply personal and widespread fight. Today, we're uncovering the science behind breast cancer and lung cancer and why awareness, early detection, and support can save lives.
But first, we must understand what breast cancer is. Breast cancer is the disease in which cells grow in the breast uncontrollably. These abnormal cells can form a tumor which may be felt as a lump or seen on imaging like a mammogram. If not treated, the cancer can spread to other parts of the body through the blood and lymph systems. Lung and breast cancer are among the leading causes of death, but many Asian Americans are diagnosed too late. According to the American Cancer Society, invasive breast cancer is diagnosed in an estimated 297,000 women in the US in 2023. Now, this may seem like a very scary number, but you must remember that cancer does not always equal death. It is important that you do not avoid any cancer screenings because you are afraid of being diagnosed. In fact, the opposite is quite true. The American Cancer Society reports that breast cancer death rate has declined since 1989 by 43% due to earlier screenings. But you may ask, how do I determine if I should get screened or not? Well, the answer would be that all people, especially with the following risk factors, should be screened. These risk factors include weight gain after 18, alcohol consumption, a family history with cancer, mutations in the BRCA1 and BRCA2 genes, which usually function as tumor suppressors, and benign cancer conditions. If you are worried that you are at risk of developing breast cancer, schedule a mammogram as soon as possible. Early diagnosis decreases death. It is recommended that women above the age of 45 are screened once every 1 to 2 years. Even though millions of Americans are suffering from breast cancer, lack of accommodation combined with cultural stigma for minorities like Asians have led to disparities within communities. Asian American cancer disparities can be attributed to lower screening rates, adaptation to the Western life, and language barriers, among other factors. It is extremely important to note that being diagnosed with cancer is not a death sentence. Many times, individuals may feel scared of receiving a diagnosis. However, as said before, early diagnosis increases the amount of treatment options. Additionally, language barriers can further delay screenings and lead to miscommunication between parties. Thus, if needed, please ask for a translator in the doctor's office or visit the American Cancer Society's Asian language support.
For this reason, many in the Asian American community lack the awareness necessary to prevent the disease from taking place, and even more fail to realize that lung cancer is the leading cause of cancer death worldwide. So what is lung cancer? Well, lung cancer is a disease where abnormal cell grows in the lung uncontrollably, forming tumors that can spread to other parts of the body. There are two main types of lung cancer: non-small cell lung cancer, or NSCLC, and small cell lung cancer, or SCLC. NSCLC is the most common type of lung cancer, accounting for roughly 80 to 85% of all lung cancer cases and diagnoses. It often arises when abnormal cells grow and multiply in the lung tissue. The three main types of NSCLC are adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. While smoking is a well-known risk factor, studies show that Asian Americans diagnosed with lung cancers have never smoked before. This is because in Asian American communities, especially among East Asian women, genetic mutations like EGFR can often lead to lung cancer even without tobacco exposure. That's why awareness, early detection, and regular checkups are crucial, even if you've never smoked before. Now, you may be wondering how you can reduce your risk of lung cancer. You can do so with 4 easy steps. First is don't smoke and avoid secondhand smoke. Secondhand smoke is basically inhaling toxic fumes from the people who are around you who do smoke. You also need to test your home for radon, which is a natural radioactive gas. You also need to reduce your exposure to air pollution, and to always talk to your doctor about lung cancer screening, especially if you're at a higher risk. Now let's hear from an expert.
For example, Asian Americans' immigrant status and the language barrier could lower the screening program participant rate. Secondly, some Asian Americans' culture try to avoid screening due to the distrust to the Western medicine. Lastly, for example, smoking stigma may defer Asian Americans participant in lung cancer screening program. I feel like a culture-tailored program have improved screening uptake. They eliminate the language barrier. They have the common culture belief, and it's more convincing to the Asian American population, by understanding their culture and their stigma.